All right, good morning, everyone. My name is Christian Gallardo, VP of Sales for iPros Insurance Professionals. I want to thank you all for attending this webinar today. Today in the studio, we have Cal Optima Health. Today, they'll be presenting on an introduction to the OneCare Dual Special Needs Plan. So very excited for you all to introduce yourselves. Lou, Maria, if you please address the audience.
Sure. Good morning, everyone. My name is Lou Melwani. I'm the Director of Sales for OneCare by Cal Optima Health.
Good morning, everybody, and I'm Maria Wahab. I'm the Member Outreach and Education Manager, overseeing enrollment into our Cal Optima Health OneCare HMO D-SNP plan.
Fantastic. Well, audience, if you don't mind, give me 30 seconds here while I go ahead and prepare this presentation.
Okay. Good morning, everyone. Again, my name is Lou Melwani. I'm here with Maria, and we are actually with OneCare, which is by Cal Optima Health. And as you can see from our screen, we wanted to share our mission first. One thing that our CEO loves to share out there is we're definitely a member-centric plan. And if you can see, our mission is basically to serve our members as far as excellence and basically getting the needs of each and every member that we have. And one of the things that maybe you don't know is the fact that most, I would say 99% of Medi-Cal members in Orange County are already under Cal Optima. So one of the things that we actually like to share with our agents is the fact that having members already with Cal Optima is being able to transition them into the OneCare plan, which is what we're actually presenting today. So as you can see on the slides, we are a public not-for-profit agency, right? We've been around for 28 years. Obviously, you know what Medi-Cal is, low income. We have children, adults, seniors. So we actually cater to Medi-Cal folks in Orange County. And we also have, we're basically receiving 4 out of 5 of the top Medi-Cal plan in California. Maria will show more information as she talks about the slides moving forward. And one of the things to consider, really important, is that we are the only plan administering Medi-Cal in Orange County. So the advantage with a plan like OneCare is that you have your Medicare and Medi-Cal plans put together into one plan called OneCare. So one of the things we also want to talk about is hopefully at the end of the day, if whenever I ask somebody what they think of OC, the first thing they say is Orange County. One of the things we want to achieve today, Maria and myself, is by the time we're done with this presentation, is OC would mean OneCare to you. OC, OneCare, Orange County, make sure keep that in mind, because again, at the end of the day, we want to show you the ease for both the agent and for the member to be actually transferred or actually signed up into a plan like OneCare. So this is just a little bit of a geography of where we are. And one of the things that I'll talk about in a separate slide is the big cities that we have. You look at the zip codes. Again, we're looking at Anaheim, Garden Grove, Westminster, maybe a little bit of Fullerton maybe. But as you can see in the geography, right, we are here, and it actually leads to my next presentation is if you can guess what the top 3 languages are right now with our current members. First one is English, second one is Vietnamese, and the third one is Spanish. So again, if you're not familiar with Medi-Cal, it's a very interesting. Again, just keep in mind, we are Orange County only. This is not LA or any other counties. So this is very specific information to Orange County, which is where we actually service. So another fact here, as you can see, is there's about 500,000 Medicare beneficiaries in Orange County. And the other thing to look at is 113,000 plus duals in Orange County. This data is as of May 1st of this year. And just to share with you, this is a big information that we have is as far as our current members, we have over 17,500 members, which is about 15.5% of the total population that we're talking about here. As you look at the next thing, this is actually a big one. We'd like to share this information. As you can see, there's quite a few MA members in this market. So they range from 2 to 4%. One even has 7% of the market. As you can see, these are people who are actually, if they're with OneCare, they're actually on a D-SNP plan, but in reality, they're moving to an MA plan. And the advantage of being in a D-SNP plan is to really take advantage of your Medi-Cal benefits. And so this is a big opportunity for agents out there if you're looking at this. Again, when I first came into the company, I was not familiar with these numbers, but this is a great opportunity for agents to know that there is about 2, 4, 7% of MA plans that are actually signing up our Medi-Cal members from Cal Optima. And if you look at the next bullet, even a bigger opportunity, right? 46% of duals are either an original Medicare or fee-for-service. Again, another opportunity to look at. Again, when you're thinking about original Medicare, you're looking at 80-20 deal or fee-for-service. Between these two opportunities here, we're looking almost at about 85% folks out there who are still in different plans, whether it's an MA, fee-for-service, or in a competitor with an MA plan. And another thing we talked about here is just like more stats for you. 86% are 65 years or older. So one of the there's actually 4 different requirements to be able to join OneCare. Number one is obviously you need Medicare A and B. You need to be living in Orange County, right, which is a service area. And the other one is you have to be 21 years or older. So if you have those 4 qualifications, you can actually qualify for OneCare. And like I mentioned to you earlier, the top 3 languages we have in these areas are English, Vietnamese, and Spanish. I'm going to pass it on to Maria right now to talk about benefits. And what I'll do is I'll come back and do a conclusion at the end of this.
Thank you, Lou. So I will give you some high-level updates about Medi-Cal because there's a lot of things going on currently that are going to impact Medi-Cal membership. So you know that Medi-Cal is California's Medicaid program. It is a public health insurance providing healthcare services for low-income individuals, such as for children, pregnant women, families, seniors, and persons with disabilities, and other groups. Today, we're going to focus on seniors and persons with disabilities. And yes, Medi-Cal offers free or low-cost health coverage. And this is important to note because of the eligibility criteria for OneCare. And in Orange County, the Orange County Social Service Agency is responsible for eligibility, application, disposition, and annual redetermination for the Medi-Cal program. And I've listed the DHCS website for you to reference to. While SSA is responsible for Medi-Cal application and the whole process, CalOptima Health is a county organized health system, and it is the only plan administering Medi-Cal in Orange County. So we administer the services. We are not responsible for the eligibility. And members with Medicare and Medi-Cal receive Medi-Cal benefits through CalOptima Health, even if they're enrolled in another Medicare Advantage plan or in fee-for-service. And applying for Medi-Cal, I've listed the several options for members to apply for Medi-Cal. They can apply online, in person, by phone, fax, or through Cover California. There's also community-based organizations that assist members with this process for Medi-Cal. Next slide. Medicare, and you guys are probably the experts in Medicare already. Medicare is a health insurance for people who are turning 65 or younger if they have a disability. I've listed Social Security Administration. They're in charge of Medicare eligibility. And so again, for members who have both Medicare and Medi-Cal, Medicare is the primary payer, meaning that Medicare will pay first for Medicare covered benefits, and Medi-Cal will be the secondary payer. Also, Medi-Cal pays for costs not covered by Medicare and provides additional benefits. And I've listed the website where you can find all this information. Also, our members are the most vulnerable populations, seniors and people with disabilities. They're low income. So because they're low income, they qualify for Medicare savings programs. And I've listed information where you can find more details about this. And I've also listed how they can apply for those Medicare savings programs. In the next slide, I've listed some of the programs that they can qualify for that may pay for their Part B, Part A, co-pays, deductibles, etc. And so now let's talk about what's happening right now to the Medi-Cal beneficiaries. And so we know that during the pandemic, DHCS paused the Medi-Cal redetermination process, meaning that Medi-Cal beneficiaries did not have to submit annual information to continue their eligibility. Well, that changed. The continuous coverage ended on March 31st. And so as of April 1st, the counties resumed that Medi-Cal eligibility redetermination. So in April, they're looking at members whose anniversary date for Medi-Cal eligibility is in June. And they have 14 months to a 14-month period to initiate and complete redeterminations to almost 1 million beneficiaries here in Orange County. And what SSA, Social Service Agency here in Orange County, the first step they're going to do is they're going to conduct an ex parte review, which reference to the eligibility technicians assigned to those members. They're going to look at information that exists in their systems. And if they can qualify that member, they will continue that Medi-Cal eligibility. If that ex parte review is unsuccessful, then Social Service Agency will mail a renewal packet in a yellow envelope. And beneficiaries may provide that annual renewal information online, by phone, in person, or by mail. I also listed the toll-free number and the website where they can submit their information. Another step of this unwinding of the continuous coverage is that the state directed Cover California to automatically enroll individuals who lose Medi-Cal coverage and enroll them in the lowest cost silver plan available before Medi-Cal termination takes place. And I've listed the Cover California website also. CalOptima service almost 1 million Medi-Cal members. So 1 in 3 residents in Orange County are our members. And we estimate that 10 to 15% could lose Medi-Cal eligibility. So our board and our executives invested $6 million to support the Medi-Cal renewal process. And some of the funds are earmarked to hiring up to 100 community-based staff or enrollment navigators. The way that this fund is being accessed is that we release a request for proposal so that community-based organizations can submit and receive funds to hire those enrollment specialists. CalOptima Health also partnered with the HCS and Social Service Agency and Cover California to develop a multi-channel communications program that includes phone calls, texting, flyers, members newsletter, community events to raise awareness. So we partner with community-based organizations, health networks, and providers, and we're conducting education about the renewal process. We're also partnering with SSA and Cover California to host Medi-Cal and CalFresh enrollment events. We co-branded with SSA so that we have to release renewal messaging. We developed video recordings in English, Spanish, and Vietnamese that are going to be released early May. As of yesterday, the videos are not available yet. The members will receive information. I'm sorry, I'm still on the other slide. The members will receive information via text, and there is a communications toolkit in English, Spanish, and Vietnamese that you can access on our website. So now let me go over the OneCare HMO D-SNP. Maybe go to the previous, the D-SNP, because This is our official name, OneCare HMO D-SNP and Medicare Medi-Cal plan, and it is the only plan in Orange County that puts Medicare and Medi-Cal benefits together. So let me explain how this goes. So OneCare has been around since 2005. And OneCare is CalOptima Health's Medicare Advantage plan, a Part C plan, an exclusively allied enrollment plan, a fully integrated plan, and the only true D-SNP plan in Orange County. I always say that all these names and designations, if you tell them to your members, to your clients, it doesn't make sense. But what makes sense is that OneCare is the only plan in Orange County that combines members' Medicare, Medi-Cal, and Medicare Part D into a single plan. And CalOptima Health has been ranked for 8 years in a row as the top Medi-Cal plan in California. So if the member is happy being with CalOptima Health as a Medi-Cal member, then it is just simple and convenient to combine their benefits, their Medicare benefits, into OneCare by CalOptima. And our members do not lose any benefits when they join OneCare. On the contrary, they receive additional benefits not covered by Medicare or Medi-Cal, and they receive more support at no extra cost. They have zero premiums, zero deductibles. So OneCare becomes one solution and with zero hassles. And I love this slide because it puts it all together. So Medicare benefits plus Medi-Cal benefits plus OneCare benefits. And you can see that our member is the focus of all our attention, and we provide care coordination. So again, OneCare is one solution with zero hassles. And eligibility for OneCare, as Lou explained earlier, is very simple. To become a member of OneCare, you have to be 21 years and older. You have to reside in Orange County. You have to have Medicare's Part A and B, and you have to receive full scope Medi-Cal benefits, meaning no share of cost. Next slide. Yes, thank you. So yes, OneCare is an HMO plan. So the primary care physician will work with the member to approve services and to make referrals and authorizations. Next slide, please. So let me tell you about the OneCare supplemental benefits that are not covered by Medicare or Medi-Cal. The first one that is very popular with our members is the over-the-counter benefit. And we offer them an $80 allowance per quarter that does not roll over. And with this $80 allowance, the members can order items that do not require a prescription, such as Tylenol, vitamins, minerals, cold and cough medicines. The member receives a catalog that includes over 300 items to choose from, and it includes instructions on how to order their quarterly items from our vendor Convey Health Solutions. And the items are shipped directly to the member's home. Our members have a pharmacy benefit, and the pharmacy benefit basically covers with zero copays generic medications throughout the year and zero copays for brand medications except during the gap. During the gap, they might have a copay of $4.30 or $10.35. And I always say might have because a lot of our members have low income subsidies that pay for those copays. New in 2023 that's related to our pharmacy benefit is that we offer coverage for sexual or erectile dysfunction, covering 4 generic pills, sildenafil pills per month. It requires a prescription. Our members have vision care that provides them an eye exam every year, glaucoma screening, and they receive a $250 allowance to purchase eyeglasses or contact lenses every year and is through our VSP providers. Our members have a fitness benefit through Silver and Fit and includes a no-cost gym membership. And in addition to that gym membership, our members can order a home fitness kit, and there's 10 different options for that home fitness kit. They also have access to digital workouts, videos, and much more. Next.
Again, transportation.
Oh, sorry. Let's go back to transportation. I'm sorry. Yeah, transportation. So transportation, our members have unlimited transportation to plan approved medical locations, such as doctor visits, labs, hospitals, pharmacy. What is supplemental is that we also provide them unlimited transportation to and from the gym. And they have also a hearing benefit where we provide them a $1,000 allowance per year, which is above the allowance that Medi-Cal offers them of $1,510. So they have actually $2,510 to purchase hearing aids. They have also worldwide coverage for emergency or urgent care, and it's $100,000 per year. And we tell our members that OneCare helps them obtain services needed to remain safely at home, such as personal care services, which actually reference to in-home supportive services, IHSS, and new for in 2023 as a supplemental benefit, OneCare offers companion care with 90 hours per year. This benefit is distinct and separate from IHSS, so potentially the members could have both. And the companion care is through our pop-up house vendor, and they help the member with transportation, light housework, companionship, technology assistance, exercise, groceries, etc. Our members could qualify for community-based adult services, and if they need to, OneCare covers long-term care in a nursing home. In the next 3 slides, I've listed a partial summary of the benefits. So you see on the slide that premiums and deductibles, they're none, 0. So our members do have coverage to doctors, specialist service, hospital service, mental health services, skilled nursing care, home health, hospice, emergency care, chiropractic, cover no cost, at no cost. Podiatry services, acupuncture, physical rehabilitation, DME and prosthetics devices, diabetic supplies, unlimited transportation to plan approved locations. And our members do have access to dental services from the Medi-Cal dental program, covered at 0 cost. And on this slide is a summary of the supplemental benefits not covered by Medicare or Medi-Cal. Again, vision care, OTC, fitness benefit, unlimited transportation to and from the gym, worldwide emergency and urgent care, hearing services, erectile dysfunction, and companion care covered. And our members do, like I explained, that OneCare combines their Medicare benefits, their Medi-Cal benefits. We provide them additional supplemental benefits that I just went over. And we also provide them with extra support, which is the care coordination. And the care coordination starts with a personal care coordinator or health navigator. And at the CalOptima level, the coordinator ensures that the health risk assessment, the HRA, is completed upon enrollment and annually thereafter. Then at the network level, which you guys call medical groups or IPAs, the coordinator will be the member's main point of contact, assisting the member in accessing their services, answering any questions that they may have. And the coordinator also participates in the care team. The care team includes the members' providers, specialists, pharmacists that care for that member. And then they develop a care plan. The care plan organizes medical, home, community services with the goal that the member will receive the healthcare that is appropriate for that member. And we tell our members that if they're Medis, they have more flexibility than Medicare only members because they can enroll throughout the year. So they can make one enrollment or disenrollment per quarter for the first quarter, second quarter, and third quarter. And then additionally, they can make another selection during AEP on the fourth quarter. Outside of those enrollment periods, they could also qualify for SEP, ISEP, and OEP. So now I have a few OneCare enrollment reminders. So when you're enrolling members into OneCare, you need to select a PCP, and a medical group, an IPA. And so here is just a few tips on how to enter that information into the enrollment application. So if the member is selecting an FQHC, you have to select that FQHC, not the doctor that they're seeing, because most of the doctors in the FQHCs, they rotate from different clinics. If you are enrolling the member and they select a community clinic, if it's a community clinic, you can select the community clinic name or the PCP. If you select the PCP, then you enter the name of the provider and the medical group that they're affiliated. And I created, can we go back to that? So there's an online OneCare provider search tool where you can find all this information. It's on our CalOptima website, www.caloptima.org. If you're selecting a PCP, next slide, please. You need to make sure that you check on that provider search tool that PCP has an open panel. And what I mean by an open panel is that they are accepting new members. If under the area of accepting new members, there's a no, that means that they have a closed panel. But if that Medi-Cal member or Medi-Medi member is going to that practice, to that PCP, then when you move them into OneCare, they can continue seeing that PCP. Next slide, please. And our OneCare program has a very robust network. We have over 7,000 doctors, and we have 11 delegated networks managing the services to our members. Next slide. So what you need to tell our members after the enrollment is that they're going to receive an enrollment confirmation letter that will list the effective date of coverage. But I'm sure that as you enroll them, you tell them when their effective date will be. They're also going to receive a mail via mail, a welcome packet. The welcome packet includes an ID card, a summary of benefits, and a member handbook. They are also going to receive a welcome member call from our customer service department 45 days after the effective date of coverage. And you also should let them know that CalOptima staff or the health network staff will be contacting them from time to time, like for the HRA. And please highlight to them the toll-free number for OneCare customer service number, which is listed on their ID card and is also listed in all our marketing materials and member materials. Our customer service department is available to our members 24/7. CalOptima Health staff mans that toll-free number Monday through Friday from 8 a.m. to 8 p.m. And then after that, there's an answering service that will take messages that the customer service department will return 24 business hours after receiving that message.
Okay, so thank you, Maria. So basically what the whole presentation is all about is, as we discussed earlier, 99.9% of Medi-Cal members already belong to CalOptima. So I think one of the things that we've also discussed is, I'm sure we all know as agents, is one of the things that seniors really don't like is change, right? We don't like change. And for them, it's really difficult to have all these, as you can see, when you do in-homes or make an appointment with them, they have stacks of materials they'll probably never read. The whole idea, I think, is to make it easier for the agent and for the member, is if they are with CalOptima and we transition them into OneCare, it's pretty much the same things they're already used to, doctors, hospitals, and now you're giving them extra benefits. One of the benefits that seems to be very, very popular is a travel benefit, right? The insurance, knowing that they're covered for emergency after 65, and a lot of seniors they actually put back their travels for after 65. So this is one way of actually giving them the opportunity to say, you know what, now you can travel, you're going to be covered. And also the additional benefits that Maria covered, which are the supplemental benefits, very important. Again, just to make sure, we're the only plan in Orange County that puts Medicare and Medi-Cal benefits together. Just remember, they're going to have one card only, unlike, if they have 2 or 3 different cards to deal with. So we're really trying to make it so much easier for everyone. And I think, this is probably the best option you have if you have somebody in Orange County who's aging into Medicare. And that's all I have. If any other questions, please let us know.
Thank you. We'll be going through the questions at this moment. I'm going to stop sharing. Great presentation, by the way. Thank you, Maria and Lou. We have a question. Do you have any recommendations on how to position CalOptima against Astiva? I'm hoping I'm pronouncing that one right. Is it Astiva? Okay.
Yeah, Astiva and CleverCare are fairly new Medicare Advantage plans, and they have aggressively targeted our Asian population. That's where we see most of the disenrollments go to. I think you need to highlight the fact that if they have Medi-Cal benefits and they go to with Astiva, the Medi-Cal benefits are still managed by CalOptima Health. They still remain our members. So that's, they're going to have two cards, a Medi-Cal card and the Astiva card to access their benefits. They're going to have to call two different member services, CalOptima Health for Medi-Cal and then Astiva for their Medicare A and B and D. So again, OneCare addresses that fragmentation, and that's how you can position and show the value that OneCare brings to that member versus Astiva.
Thank you. We have another question from Amelia Liman. For 65 years and older, which traditional Medi-Cal, not MAGI Medi-Cal, can they apply for Medi-Cal through Covered California, or must be through calbenefits.com or in person or by phone only? That was kind of a tricky question.
So I think that's related to the unwinding of the Medi-Cal eligibility. So again, the process that has been established by the state is that Cover California is linked with SSA, and they will receive a list of members that are about to lose Medi-Cal, and they are going to automatically enroll them in the lowest cost silver plan available. So that's the directive and the instructions that we're seeing. And I'm not familiar with Cover California. I would defer that to IPROS because I know you have Cover California and you participate in that as to the details. Also in the instructions, and you can go to dhcs.gov to find out even more details about this process. I read that the premium under the silver plan will be pause or defer for 1 or 2 months. Don't quote me on that. Again, I just saw that on the website.
Perfect. Thank you. Next question from Erica Green. How many chiropractic visits and how many acupuncture visits?
Okay. So both are need to be referred by a physician. So it depends on the clinical medical need, and there is a maximum, and off the top of my head I don't know the maximum amount of visits. I think, and again, don't quote me on this, I think it was 2 visits per month, but I can get back to you by referencing our member handbook on the website.
Perfect. Thank you. Another question from Naun Mancia. Are Medi-Cal aid codes a factor to qualify for this plan?
The major aid code is that they cannot have a share of cost. They cannot have restrictive Medi-Cal. They cannot be incarcerated. There's several exceptions. Everything else, all those other aid codes qualify for OneCare. Prior to December, we used to have the Cal Medi-Connect. It ended in December. And for Cal Medi-Connect, there were specific aid codes that excluded the aging population. Starting January 2023, most Medis qualify for OneCare, and hence the opportunity for the agents to enroll members into our program.
Perfect. Thank you. Next question. For the dental benefit, it's only for medical dental. There is no additional benefit, correct?
So actually, formerly known as Medi-Cal. DHCS restored adult benefits in 2018. So there's a lot more benefits, dental benefits that are approved. And you can go to, I think now their website is called Smile California. I think I also shared the information, the flyer for Medi-Cal Dental Services with iPros. So the iPros, if you can share with them. And so again, there's a lot more benefits, dental benefits to our members through Medi-Cal.
Thank you. Next question. How soon does the personal care coordinator reach out to my clients after enrollment? Is it by the effective date? I've had several clients that have stated they haven't been contacted and I don't have a broker services number to call.
So let me address the first question. So the personal care coordinator the protocols that they have is that they will outreach to the member based on the medical condition of that member. If that member needs care coordination ASAP, they contact that member within the first 30 days. Otherwise, I believe, 60 day. There's a 60-day period that during that time, they have to contact that member and complete that HRA. If the member wants to know who their PCC, their personal care coordinator, is at CalOptima level, because that's the first step, they can call our member service or toll-free number and find out who the coordinator is. And if they want to complete their HRA before CalOptima Health calls them, they can do so.
Okay, thank you. Next question. Hopefully I'm pronouncing this right. Our HOAG, how do you pronounce
Hoag, the hospital?
Okay,
Yes.
That's a hospital, thank you.
Well,
Okay.
it's also an IPA, a medical group.
So Amelia's asking, are Hoag, UCI, and Providence, St. Jude/St. Joseph in the network?
Yes, they are. They're under CCN, not as a medical group, but they're affiliated as a provider under CCN. Actually, Hoag is affiliated with many of the other delegated networks, but UCI, St. Joseph, and St. Jude, which now St. Joseph and St. Jude is Providence, they're affiliated under CCN.
Thank you. Next question by Maurice. Member chose not to enroll in OneCare in order to not being constrained by a medical group. How do you overcome that?
So basically the member selected to be in fee-for-service. Is that what I'm hearing? That's how I interpret that question.
Yeah,
So,
Maurice, if you can specify a little bit more on that.
yeah. So again, it's member's choice, right? Every Medicare Advantage plan has its merits. Fee-for-service has its merits. And as an agent, you're not really selling that product. You're trying to find the best plan that fits that member's needs. You're going to do a needs assessment and find out, again, what is going to be best for that member. If fee-for-service is best for that member, then, I would say leave them there. For example, if they're going through cancer treatment, if some of their treatments even involves going to LA County or another county, if you enroll them into OneCare, remember it's an HMO, their auth and referrals will have to be reissued and may impact their continuity of care. If that doesn't exist, then again, the same thing as when you show the value proposition of OneCare compared to another MA plan or fee-for-service will apply also to fee-for-service. They're not going to have a fragmented plan. And with fee-for-service is the most fragmentation of the benefits because they're going to have Medicare managing A, B. They have to sign up for a Part D. They may even have some copays. And Medi-Cal is still going to be managed under CalOptima. 3 different ID cards, 3 different organizations, 3 different member services. So again, that is the value proposition of OneCare, is going to put it all together and give them extra support at no extra cost.
Thank you, Maria. And Maurice, if you could elaborate a little bit more on your question, that we want to make sure we address your question properly. We have a couple more questions. It's stated CalOptima is the only true D-SNP. How is it that other health plans continue to enroll Medis on plans they have created? Is it as competitive as OneCare?
Yeah, sure. So that's one of the things I addressed earlier, right? A lot of the plans are signing folks into MA plans when we are the D-SNP plan. So one of the things I just want to remind everyone, number one, we're just in Orange County, right? Number two is CalOptima has actually been very aggressive this month. If you're in the Orange County Airport or even in Brea Mall, I'm just giving you examples. We have they're really out there promoting this product right now. And that's one of the things we actually talked about earlier is if you have a chance to sign somebody up who's already with CalOptima Medi-Cal, and now you want to switch them. So there's about 7% or two. Some of them are 2%, 4%. I think there's even a company at 7% who are signing our members. And I think a lot of these members don't realize they're going to an MA plan when they can actually be transitioned into a D-SNP plan. And the advantages, the benefits are very similar. As you can see, Maria went through them. I think what the value proposition here is that, again, like I mentioned earlier, a lot of seniors don't like change. They're already used to they're used to their CalOptima cards, having one card at all times. By transitioning them into OneCare by CalOptima, and that's probably one of the things you want to address when you're actually promoting this product, is say OneCare by CalOptima. It gives them some peace of mind knowing that they are going to something they're familiar with, right? Less change, more familiarity. As you can see, most of the doctors, the providers, the hospitals are the same. And I think it also makes your life as an agent a lot easier, knowing they're going from a plan they're already familiar with to another plan that's similar. Now they're getting additional benefits, the transportation. Just remember the gym, the transportation to the gym sounds kind of, you probably saw what the heck what is that for, right? We do have a lot of homeless people in Orange County who take advantage of the showers, the advantage of actually being able to go to the gym and survive on a daily basis. So to answer your question, I think that's what's happening. They're not aware that they are signing up with an MA plan when they can be with a D-SNP plan.
Thank you, Lou. Last question. We still have a few more minutes with Lou and Maria, so if anybody has any other questions, please go ahead and send them while we have them here. The other question is, I work with the Vietnamese community. What kind of alternative medicine benefits are included?
So under the over-the-counter benefit, there are vitamins, and there's herbal vitamins that are offered there. If our agents find out that there are other over-the-counter benefits that should be offered to our members because they prefer them, please send us an email, because we're in the process right now of developing the benefit package for 2024, and we can work with our vendor to add more over-the-counter items.
Just Maria, just to add as well, some of the more popular items we have from OTC are like Tiger Balm, things that you can buy like from the 99 Ranch Market or the Vietnamese markets. We are starting to cover them, and they're actually really popular. So just so you know.
Yeah, thank you.
Another question, can the member use the transportation benefits to go to gyms or dentists?
I can confirm that, but it's a medical service, so yes.
Okay. We don't have any other questions coming in, so I'll turn it over to Christian for closing.
Thank you, Rodrigo, and thank you to everyone that attended today. Maria, Lou, thank you so much for being in attendance and informing our agents about the incredible value that the OneCare plan has for its members. And with that, I just want to conclude this presentation. So thank you all once again, and I hope you all have a great rest of your week.
Thank you.
Thank you.
Thank you.